Aware that cases of leprosy infection is still being recorded in Nigeria despite meeting the World Health Organization elimination targets in the year 2000. Currently, the country records about 3,500 diagnoses annually. Our correspondent, Chenemi Bami, visited a leprosarium in Minna and has details in this report.
Today makes it a year and 2 days since Sani Sidi came here for treatment after he contracted leprosy. He said he has been provided free treatment, given free drugs and food all through his stay.
I'm very, very better because they told me yesterday, they said that I will go back on Monday. And I'm very, very well. They supply with medicine that I will go and use at home. Give me some food that I will go and chop at home. So I thank them very much.
Also known as Hansen's disease, HD, leprosy is an ancient chronic mycobacterial infectious disease that is associated with serious morbidity. Although curable, it continues to be a disease of public health concern because of the stigma associated with it. In Nigeria, leprosy is still prevalent and remains a significant public health concern, with over 3,500 new cases being diagnosed every year in the country. According to the Nigerian Center for Disease Control, 25% of the affected persons get irreversible deformities. This hospital, founded and funded by the Leprosy Mission Nigeria in the early 50s, is the only available center for treatment of leprosy in Niger State and supported by the government. As the world marks International Day for Leprosy, these volunteers gathered here to help the patients clean the environment.
Treatment is free and it is curable. Currently, we have 16 male patients and we have 7 women currently on admission. Some of them are just from Niger, but we have people from Ebonyi State, we have people from Adamawa State, we have people from Kebbi State who are currently on admission here.
When we came around, we noticed that the hospital where the patients are, it's looking very dirty and it's not convenient for them to live in a dirty place. And that was the reason why we decided to come out in our numbers to do the sanitation so that they can have an habitable place.
Leprosy disease usually occurs after prolonged contact with an infectious person. It is passed from person to person via droplets from the nose and mouth during close and frequent contact with someone with untreated leprosy.
Hospitals and settlements like this are the only hope for leprosy survivors. They need a lot of government support and attention to cater for the people here. Chenemi Bami, TVC News, Minna.
Away from that, a coalition of activists